A warm welcome to all of you for joining us on a Saturday evening. And thank you, Dr. Prem, for taking time out of your busy schedule and being here for this AMA. So many of you have been part of these with us. This is our third edition of the AMA, which is Ask Me Anything series. And today we are focusing on how to manage multiple medications in older adults. So, what is the reason for something like this? So the work we do at Silver Talkies is also to spread information and awareness about, when we talk about caregiving, aging, there are so many aspects of it as we discover every day in our work. And it cuts across every age, people, caregivers, younger people who are taking care of a parent, grandparents. There are many issues we discover every day as we deal with aging. And this is the thought that was there in all our minds as a team. We felt that, this is like an intergenerational way of, bringing two generations together. So we felt that if there could be a way where, it becomes easier for the, younger people who are taking care of older adults, and in a space where we can allow them to ask any question that comes in their mind, and even older adults themselves. So today's topic is how to manage multiple medications in older adults. And the whole idea is that very often older adults take multiple prescriptions, and how to manage their well-being across all those health parameters, how to keep track of various medications, how to avoid mistakes, how to keep it a safe experience for everyone, especially the older adult. And Dr. Prem is going to tell us more about it and clear any questions that the audience may have. So there are a little bit about Silver Talkies and the work we do. For those of you who are joining us for the first time, Silver Talkies is a social enterprise that's focused on active and healthy aging, and with an eye on creating resources that encourage social engagement and highlight talent and passion among older adults. Our mission is to engage, empower, and encourage diverse experiences for older adults. And we do this through events like these, through our online magazine, and we have a very vibrant and active club called Silver Talkies Club, which is a virtual space for everyone above the age of 55. And you can join it now from anywhere in the world, because events are available live online from across the world. So without further ado, let me introduce Dr. Prem. Dr. Prem, welcome here again. And he is the Chief Consultant Geriatric Medicine at the Department of Geriatric Medicine, Jaslok Hospital, Mumbai. His major objective has been to establish a strong framework for holistic elderly care. And Dr. Prem started the Department of Geriatric Medicine at Jaslok, and it's the first of its kind in South Mumbai. He is also associated with the Graceful Living Initiative in a leadership role. He has been instrumental in organizing support groups, lectures, and camps for older adults. And we are very fortunate. He has been a regular columnist for us, and he has been, integral part of Silver Talkies for a very long time. So thank you for that, and welcome here, Dr. Prem. Over to you.
It's always very great to be back on the platform of Silver Talkies. They're doing some wonderful work. But I think what we are going to talk about today is one of the most important things if you might not want to go to the doctor for, but you always expect them to give you, and that is medicine. A lot of times you might need medicines, a lot of times you might not need medicines. Of course, I as a geriatrician in my field of work always emphasize the fact that it might be better that the lesser the medications, the better it is. And whenever we prescribe medications, it is always for a reason. It's not that doctors want to prescribe medicines, but it is sometimes things cannot be managed just by pure lifestyle advice, whether it's diet, whether it's physical exercise. Multiple medications in older adults. So it would be wonderful that we do not have medications at all. But as we age, a lot of times we might have comorbidities. That is, a lot of diseases might come in, whether it's age related or whether it's diseases which are due to the risk factors which maybe couldn't be tackled earlier, or maybe which should have been sort of taken care even now. So you have to be on medicines. Now, sometimes it can be escaped, sometimes it cannot be escaped. However, what are the challenges actually in older adults? The ones that we face from both sides, I'm saying, it's not only the doctors, it's the older adults themselves. One is the multiple chronic medical problems. So sometimes people might have diabetes. With diabetes, they might have hypertension, they might have dyslipidemia, they might have a heart disease, they might have a history of stroke, they might have hypothyroidism. So sometimes everything comes together. It's no unwritten, it's not a written rule that you will ultimately get only one disease and you might not get the others. So multiple chronic medical problems are always could be there. Then multiple medications and prescribers. Now, a lot of times you might need specific care by specific specialists. Now, for example, if you had a cardiac event, you might have gone to a cardiologist. If you have a kidney event and you have to be on a follow-up of a kidney specialist, you might have to go to the nephrologist. So sometimes multiple medications come in through multiple prescriptions through multiple practitioners. But ultimately what happens is, what would always help is that you have a consolidated list, rather than you might sometimes miss that you are actually going to multiple people and you might not be asking them as well that whether this medication was needed or not. Then different metabolism and responses. Now one has to understand that as we age, it is the day we are actually born, that itself we start aging. So the first birthday itself, we are known as 1 year old. So it becomes 1, 10, 15, 20, 25 years old. So we are getting old every day. So if your body is 50 years plus, 60 years plus, whatever, 25 years plus, there is a difference in the metabolism, that is your body's reaction to the drugs, and also how you break down the drugs. So that is something which changes as you obviously become older. Another very important factor is adherence and cost. I think cost is something which is always taken into consideration while prescription, purely because a lot of times certain medications which are mandatory might be costly. And sometimes the older adults might need support also to acquire those medications, whether financial or social. Adherence is another important factor. A lot of times we might prescribe medications, but older adults do not follow the same for a long period of time. Or sometimes, for example, if the blood pressure is regularized and the general tendency is, no, now it's normal, so why should I continue taking the medication? But however, the control was because of the fact that you actually took the medication. Then there is, of course, the supplements, herbal supplements, the over-the-counter drugs. So a lot of times you might be also taking a lot of other drugs which you don't necessarily mention to us until unless we actually ask you. So one has to understand, as you're aging, there are certain normal changes which occur. One is the overall water intake itself in the body that reduces, and the overall water in the body that will reduce. More amount of fat is there. Muscle mass, which we obviously known as in Hindi maspeshi, that obviously decreases. Now your drugs are actually broken down. A great amount of them are broken down in your liver. So the liver breakage, which we call as metabolism, the breakdown of the medicine also happens much slower as you get older. And a lot of the drugs are actually excreted, that is thrown out of the body after their usage, is from the kidney. So the kidney obviously has age-related changes. For example, the amount of filtering of the urine that occurs as you are younger, and more robust filtering will not happen as you get older. So that also occurs. So these are the challenges without even you actually being sort of given the medication. Then, of course, there is something known as polypharmacy. Now, polypharmacy is there could be more than 5 drugs at a time, and that can be classified as polypharmacy. But a lot of older adults might say that, but we have 5 to 10 diseases, then how can we have only 4 or 5 medicines? Now, a lot of times there's something known as essential or non-essential. So sometimes if you have some diseases and you have to take, so that is known as essential polypharmacy. So you will have to take those drugs. Because those drugs might be life-saving to a great extent. For example, if it's for your heart, if it's for a history of stroke for your brain, or if it is for example, if you have asthma, you have to take your inhalers, because if you stop them, then obviously you will suffer. But there is something known as non-essential polypharmacy. Like, for example, you might have 5 drugs, but over that you're having 3 supplements, all vitamins, all same content. The only thing that is different is the names. So that is not adding up to anything. Then you are taking painkillers without telling people, or you're taking things over the counter without telling your doctor. So then that is when the issues start. Now, why are we worried about this polypharmacy issue? Is because it increases the drug side effects. So every drug might have some side effect. It's not necessary. If you go and the biggest person you should never ask about drugs is Google, because once you will go into Google and every drug has every side effect. So you might start considering, oh my God, I'll take it, and the next day I'm going to have, next minute I'll have that. No, that's not the way it works. But there are adverse side effects which we obviously have to sort of give you a precaution about, or make you give a caution about it. And you should, whatever you found in Google, my advice is, please try to clear those doubts with your doctor rather than thinking that's how it's going to be. So Google doctor is a strict no-no. Then drug to drug interactions. Now one has to understand that if you have one medicine and you have another medicine, sometimes this particular medicine might be interfering with the working of the another drug. Sometimes duplication of drug effects. For example, you are taking pantoprazole, which is known as Pantop. You're also taking Pantocid, which is also pantoprazole, but you're taking twice without knowing that there is actually the same medicine. But sometimes it happens. So that obviously is a risk. Then pure adherence can happen if there are multiple drugs. So the cost will come into effect. A lot of older adults consider, okay, they have asked me also. So, sir, do we take these? So doctor, do we take these medicines? Which are the ones which are very important, and which are the ones which we can sort of avoid? So a lot of times you cannot avoid, but cost becomes important. So for example, even the government setting, and if other settings where people actually, even in the rural setting where people might be only able to buy that particular drug, which is most important. So adherence becomes poor. So they might not continue to take. Then decrease quality of life. Multiple drugs with multiple side effects with your aging body will obviously lead to harming your life more. Then what is the issue with, of course, the adverse drug events? There will be adverse symptoms. So the patient outcomes which are issues is there will be more doctor visits, more hospitalizations. A lot of drugs have side effects that they will interfere. Maybe they will cause falls. Then the overall, your quality of life or independence, that is what matters the most. So that might get affected, that might decline. Then changes in cognition, of course. Usual cognition might change, or you might actually go into a confusional state, which is known as delirium, and of course death. So a lot of times, if 2 drugs are taken which are absolutely interacting very badly to each other, they can obviously lead to the worst case scenario of death as well. So increase in number of medications is increase in drug side effects. Of course, it is not all risk, and it can also happen if all the medications are clinically indicated. So we need to understand that you can still have those drug side effects, but you need to know which might and which might not. So how do we increase, from a doctor's perspective, how do I make sure that you adhere to the drugs? One is, of course, I would love to keep your medication list short. Then try to have maybe daily once medication. Sometimes the dosage, if it is more times, then there is a tendency of forgetfulness even more. I would want to encourage the use of a pill box. Now, what happens with the pill boxes, it is good for caregivers also, because sometimes, a lot of times, older adults do not take their medications. They only make pill boxes in which they can actually say morning this medicines, afternoon this medicines, and in the night, of course, this particular medicines. So that helps in the older adult also understanding, no, these are the times I have to take. Always review the bottles of medications and see the expiry. It is very, very important. When you get the medication also, you should see expiry. Of course, there are challenges with that. I'll come to that later. Keep reviewing bottle of medications. Do not wait till your appointment is going to come with the doctor and then just 1 or 2 days before buy. Always have maybe that 1 to 2 weeks, 3 weeks extra medication. Fine. If And usually it's the pharmacist you buy from everywhere, every time. So you will be able to exchange or change it also if there is a change in dose. Never be like in a deadline, like you have 1 day to go to the doctor, you have only 2 tablets left, and then only you're going to get your next. Try to have a bit more extra, or adjust your appointments to the doctor maybe 1 month before. I mean, 1 week before you're actually going to come. Then we can obviously help you by seeing indications for medications or prescriptions. I mean, usually I do, this is for blood pressure, this is for diabetes, this is for your gas problem, this is for your constipation. And I always make sure that you should bring all your medications, at least one strip, so that I can see that at least you're taking, because there are a lot of medications which can sound similar. And there have been instances where people have actually ended up taking medications that they should not be taking. So, but it's not only what I can do. We'll come to what older adults can do and their caregivers can do. But before that, we have to understand medications work differently in older adults. One is there is an aging body. Then there is your digestive system. So overall, the metabolism will be, the breakdown of the drug will be obviously slower. Then there might be multiple medical conditions, which I have already talked about. Effects of food and beverages. We have to understand. That's why we specifically write that this is the medication you have to take with food, or this is the medication you have to take before food, or this is the medication you have to take after food. So a lot of drugs, if you take, for example, if you take a certain drug which is actually to be taken after food and you take it before food, then the action might not happen, and you might end up taking it for 1 month and come and say that no, nothing is improving. So that's why those minute details matter a lot. Then one drug and another drug interaction. Now, for example, with food, I will tell you there is an anticoagulant. Basically, it is something which makes sure that your blood remains thin. So that is something known as warfarin, which might have to be taken by certain people for certain conditions. But if you take green leafy vegetables with them, then the effect of that particular drug reduces. So food and that drug might interact, and your effect will go, and ultimately you might end up having bleeding as well. So that is a risk which is there. Then medicine and medicine. For example, calcium and iron. Calcium and iron we usually do not give together because they interact with each other and cancel each other out. So the calcium will not add and the iron also will not add. Then there are other factors also which are very, very important. For example, vision. You might see the drug, you are not able to know what is the drug, what is the spelling of the drug, you're not able to understand on the bottle. So such things are important. And polypharmacy, which I obviously sort of already covered. Now, what do you need to do when you actually visit your doctor? So keep a list of all the medications you take. It really helps. Ask for side effects your medications can cause and what you need to watch for. And ask doubts to your healthcare providers. Of course, one of the common things that a lot of older adults tell me that no, the doctors do not have time to explain. No, there is nothing like that. To be very frank, take a lot of time in explaining, and most doctors do. And even if they might not have the time, because there is another person after you who's waiting for the prescription, there is usually a pharmacist or another person who will be explaining, whether it's a nurse or whether it's a pharmacist, who will be explaining those medications, how you have to take and how many. Because I have seen this in busy practice where doctors make sure if they are not able to do it, then they facilitate you by telling somebody else to do it. So, and that is something which is very, very important. Then there are certain tips which really help and which will help you always, especially with multiple medications. One is make a list. Make a list of all the medications you're on, which I'll come to. Review your medications regularly. Remember, it's your body, you are taking their medications. So reviewing your medications is also your responsibility and your caregiver's responsibility, and not only the doctor's responsibility. Look out for side effects. Over-the-counter drugs are strict no-no. I mean, a lot of people do not wait for a prescription for most drugs. And unfortunately, in India, a lot of drugs are available over the counter. And take your medications properly. Now, just to elaborate on these points, Make a list. So now the list should not be only the drugs which are prescription, all non-prescription drugs, homeopathic drugs if you're taking, Ayurvedic drugs, oils, lotions, ointments, all of them are drugs. So you have to put everything in the list. Because sometimes older adults are like, no, we are putting that Ayurvedic oil. Why to tell that? I mean, that is not going to make us big significant change. No, but you should know that list is very important. Write down the doses. If you're able to do it, you should write down the doses and you should know what they are for, or the caregiver should, because ultimately you are the ones who are taking the drugs. So if you are, of course, in a mental state, in basically having enough brain power or cognition to understand your drugs, yes, then you should be knowing the doses and what they are for, because ultimately it is also your responsibility. Then review your medications regularly. How do you do that? Read your prescriptions carefully. Instructions on how to take the medication, whether it's with food, whether it's after food, whether it's before food, whether it's with water, can it be taken with milk, does it has to be powdered with milk, with water, whether it's warm water, whether it's normal water. So a lot of times detailed instructions are given. If you have a doubt, please ask, because certain drugs can be difficult to eat. So instructions are given that way. Then what it should be or should not be taken with, and a potential for medical interactions. For example, there is an antihypertensive which can cause swelling of your feet. So whenever I start that, I always tell my patients that this might cause swelling on the feet. It's not necessarily for everybody, but it can. If it does, and it's an issue, please let me know, then it can be changed. Then look out for side effects. I mean, it's not, as I told you, not through the Google doctor thing, wherein you look and you will be like every medicine causes nausea, vomiting, every abdominal pain. So if you generalize everything, that will be very difficult. But if you think you have a problem taking some medication and you're already having some kind of a bad reaction, or the medication is not working, please get in touch with your healthcare provider soon so that it can be solved. Then over-the-counter medication should maximum be avoided. Yeah, I mean, I can understand. You might tell me that if I have to take a paracetamol or maybe a Dolo or maybe just a cough syrup, I shouldn't be asking the doctor and taking. Avoid it to the maximum. Please ask somebody and then only, whether it's your relative who's a doctor or whether it's a doctor per se, please ask and then only buy them. Because a lot of times your drugs and the over-the-counter medications might be causing interactions and the effectivity of the drugs might go. Then there are challenges as you get older. So you might have difficulty in reading and understanding the directions on the label. The print might be too small. The directions may be unclear, that how should I take the medication or how should I take this pill. So in that case, what has to be done? Of course, if you are not understanding, then there has to be somebody else with you, hopefully on that appointment, who also understands, or it's the person who is giving you will be able to understand. Then very, very practical issues like opening the medicine containers itself. A lot of people might have Parkinson's disease, they might have tremors, they might have weakness in the hand, they will not be able to open the medicine, they will not be able to pour the medication or even fill a glass of water. So of course, in this case, they need more help. They will be functionally dependent and they might need more help. Apart from this, it's also very, very important that you also help yourself. Now, how do you help yourself? Now, technology is very, very helpful these days, and gone are the days where older adults were not taking help of technology. I think one of the biggest positives of COVID is that more and more older adults have come online, more and more older adults have actually embraced technology. I mean, we can very well see the evidence that there are so many older adults and their caregivers who are actually online now, even attending this particular thing online. So there are certain things known as pill reminders. Now you will have reminders in your phone that, so this is the time for you to take a pill. You can take help of apps. There are also certain apps for drugs which will actually store your drug schedule, and then they will remind you accordingly when you need to take the drug or you cannot. Then, of course, you can do it in another way. And this is something I always say, a lot of older adults love to write things down. So try to write your medicines completely down and maybe tick them off daily. I know you might say that why do I have to write it every day? But if you're not comfortable with a pill reminder, at least every time you'll be able to go and see, okay, this is done, so tick. So at least you know you have taken your medications. Now, apart from that, there are certain questions that people get tensed about. Now, what happens if I miss a dose and then take a medicine maybe later in the evening? Usually that's not much of a problem. But if you miss a dose for 1 week and just say that, oh my God, I forgot to take a medicine for 1 week, and then you'll take, then that's an issue. Then sometimes you might end up taking double the dose. Now that can also happen. Of course, it depends upon what medicine it is. For example, if it is an antihypertensive and you take double the dose, the BP might come down suddenly. So you might have to just take the BP and see. If it's, of course, a painkiller, your pain might get relieved, but if it is a risk to your kidney, then that might be an issue. Sometimes certain medicines, if you take more, sometimes we have this feeling that more the dose we take, more the effect. No, nothing like that. So every drug has its potency. So if you take 300 milligram or maybe 40 milligram of the same medicine, sometimes 40 milligram of the medicine is causing the same effect as 300 milligrams. So one has to understand that it's not only the increased dose which actually helps. In certain medications, even the lowest doses are fine. And that's how we follow. We try to give you the lowest doses first and then slowly increase it depending upon what your side effect profile is. So as I said, almost everything in older adults sometimes seems complicated, but it's not. If we break down things one has to understand what you need to do when you're home. So as I said, when you're home, make a list. You should know all your medications. You should know when you have to take which medication. You have to take, of course, your food accordingly and what all you can do for your multiple diseases. When you're at the chemist, of course, before the chemist, when you went to the doctor, yes, you have to ask for whatever you can, whether it's about the side effects. If the doctor most of the times might tell you directly, if not, you want to ask questions, fine. Then the third thing is, after you get the prescription, check the prescription if you have any doubts immediately. If you're not cleared with the doubts or suddenly you remember the doubts, get in touch with your doctor. Or next is, of course, if there's a pharmacist there, sometimes there's a multidisciplinary team in which there will be a pharmacist also helping you. Then third is, of course, when you go to purchase, make sure that the expiry is good. Yes, most of the pharmacists will not, they will never give you expired drugs, but yeah, it's better to be safe, trying to see whether the same drug has been given. Hopefully they are not making any mistake. And then, of course, try to clearly see. I know you might not be taking drugs yourself a lot of times, and older adults might be dependent on their caregivers, but maximum try to know the name of the drugs. A lot of older adults might only do it by the name of the color or the size, or even maybe the way it looks. Certain medicines can be broken down, certain medicines cannot be. So sometimes that might be difficult for you. For example, a capsule cannot be broken into half and taken because the medicine itself will get sort of dispersed. Then when a change occurs, try to understand the change. For example, if there is a medicine which has been halved, so you have to take half, whether you can take it half or not, or you might actually have to sort of buy an entirely different strip. That is something you need to understand. Then another very, very important thing is with liquids, how many times you have to take, how many spoons you have to take. It's a good thing that most cough syrups or most other liquids also have, suspensions also have this measuring cup in them. So measure it, and accordingly, how much the doctor has actually told you to do, take it yourself. So I would say with drugs also comes a lot of responsibility of the older adult, but a lot of times they cannot take the responsibility. So the caregiver is equally important, purely because there might be vision problems, there might be problems with writing, there might be problems with feeling, there might be problems with mobility. So the older adult might be dependent on other people for taking drugs. So if you have multiple drugs, try to break down which medicine is for what condition, and accordingly try to take those drugs. Again, I would say reiterate the fact that do not be too much dependent on Google, because it is an issue. it can be very scary. If you just go into Google and write side effects of this particular drug, and it might say almost everything on this earth, then you might end up thinking that I shouldn't sort of take this medicine at all. Then another common question that is obviously asked, which is that whether you can take other, for example, Ayurvedic medications along with the other drugs. Now, see, the thing is, we are not against any kind of Ayurvedic medications or homeopathic medications. But the point here is very simple. There obviously occurs trials of medicines, and now you know very well that there is a department of Ayush and all the trials of Ayurvedic medications that are happening. So whenever there is an evidence of any medicine, it's very easier to prescribe. So it will be very difficult for us to tell you that whether there is an interaction with this or not, because the trials of allopathic drugs and Ayurvedic drugs are far from, I mean, they're not really been done. Secondly, do not try to mix everything up. So for example, if you're taking Ayurvedic also, homeopathic also, this also, all the same time, then they might just end up interacting with each other and canceling them out. So that might actually happen as well. So be careful about it. It's very, very important that you need to know what drug you're taking. So I think that is, to be very frank, the biggest motto of today.
Thank you very much. That was actually, your presentation covered a lot of questions people have. Questions is, how often should an older adult go for a checkup to realign their treatment plan with the main doctor?
So, I mean, the answer for it is very simple. It depends on, of course, the number of diseases you have. So, for example, and your doctor always tells you on visits. Now, it depends whether, for example, if you are, I'll give an example of a kidney disease. If you have a chronic kidney disease, then you might actually have to follow up much more frequently. But as compared to a person who might just do a normal health checkup, you might just have to do an yearly health checkup and maybe see your doctor. So that is the biggest difference. So I think, unfortunately, the truth is, the more disease you have, the more times you might actually have to see the doctor, which is very much, I mean, that's very common sense. But in that also, sometimes follow-ups are something which we decide depending upon how you're responding to treatment. If you're okay, then for certain conditions, we see maybe once in 2 months, once in 3 months, once in 6 months. So it varies. But if you say ideal health checkup, at least once a year, you should do all your blood tests just to know what you're doing. And I would say, before you do your blood tests, try to get in touch with your doctor rather than just going for the packages, because sometimes you end up doing something which is not needed, and then it comes increase, and then you're just losing sleep over that. So it's always better to go through the doctor and then do the required tests rather than just doing the packages and going with the results.
Definitely. Thank you for that. You know, one common question many people have, there are very few geriatricians like yourself. It's hard to find geriatricians. So in a case where, you know, a person is going to a doctor for maybe BP, for a cardiac issue, for osteo issue, multiple things, who should be the overseeing doctor who can help align different treatment plans, you know, just in case they do not find a geriatrician?
Now, see, I'm very sure that you would already have your family doctor. So I think the family physician is somebody, if you don't have a geriatrician, might be the one who will be coordinating everything. And even if there is a geriatrician, the geriatrician would obviously help in adding to the care which is being given already. So I think this is, see, like how for pediatrics there is obviously a doctor known as the pediatrician. This is specifically a branch which is for older adults, because we as geriatricians recognize that you as older adults also have specific needs. Obviously, it's an aging body, and the conditions which are there as you get older have to be treated in a certain way, and as compared to maybe a normal younger person. So one has to realize that. And I think, yeah, I mean, if there is no geriatrician around you, then of course, please be dependent on the family doctor. The reason I'm saying is because they will know a distinct history of yours, and they might have obviously been in touch with you for a long time. So it would be easier for them to manage.
Absolutely. Thank you. So I'm just, let me just see so Mr. Boulton has asked, Doctor, do you generally inquire from your elderly patients with medical history as a geriatric doctor before prescription on the present problem and symptoms? So do you generally inquire the whole medical history? That's what.
Yeah, absolutely. And to be very frank, I think older adults are one of the best historians, if I have to put it that way, because they're so organized. And so sometimes it's hardly, I don't have to do anything. I just ask and they just show me a paper. So they actually have it in the details of dates, and even the year. So it's very easy for me to go. And some people don't have it, but they remember enough. So yeah, I mean, knowing a past medical history is very, very important, because it helps us in, one is of course regularizing your current issues. And also sometimes knowing the past doctors helps us, because sometimes we end up discussing with them if this was the case, or how different it is, so that it obviously helps us in a common plan. See, the common goal we have is actually to improve your quality of life and make sure you're more independent to a greater extent, of course depending upon your diseases. Yeah, absolutely, a medical history is a total must, and it's inquired in every, in fact I inquire it in every visit. But as you visit more frequently, obviously I will get an idea of what I have to take care of. So obviously as you go, I mean, the follow-up increases. Maybe it is more about regularizing what you're already on.
Perhaps, very briefly, it would be helpful for the audience to know exactly what a geriatrician does, if you don't mind sharing that very briefly.
Yeah, see, so basically, I think as a geriatrician, I understand that your health, that is an older adult's health, does not only depend upon your medical symptoms. It does not only depend upon your diseases. So what I tend to know is the entire thing about you as an individual. What matters to me is how your memory is, what your cognition is, whether you're feeling low or not, how your mood is, whether you have any issues with any history of falls, whether there is a history of urinary issues, constipation. Then if there are history, is there any, what is your social sort of engagement? How's your family, whether you live alone, which floor do you live on, do you have a lift, what are the your medication history matters a lot. So that history also is something I take, and depending upon what I find through the history, of course I do specific scales are done by geriatricians to know specifically whether you have a cognition issue, whether you have a risk of fall. Now the point here is to do an assessment in which we are able to know not only what you have now, but try to substantiate it to prevent things which might happen in the future. For example, treating a fall is difficult because it has a lot of issues. It can have monetary issues, it can have mortality, it can have long bedridden time, but preventing falls is easy. So I would want to say that we try to focus on a lot of preventive issues and try to treat, of course, the issues which are already there. So, and one of the very important things is, I think every doctor gives a lot of time, but on our first visit with a geriatrician, a lot of time is given to the older adult because there are challenges. There could be a vision challenge, there could be a hearing challenge. Certain older adults can't walk, so they will be slow to respond. So those challenges are always taken into consideration, and adequate time is given for the older adults to express. One tip for the caregivers: whenever you take your older adults to a geriatrician or any doctor, let them speak too, because a lot of times I've seen that the caregivers end up speaking a lot, and the older adults might have an issue, but by the time maybe the time is over or they are not even able to speak up. So you want to add, but a lot of times older adults want to express what they need to know or what they need to ask. So give them the chance to do that.
Thank you. That's a very important point. Thank you. Mr. Murthy has asked, in multivitamin and mineral tablets, both iron and calcium are present. So in this case, how does it react with the body? This is, I think, in reference to your point.
Yeah, I mean, usually when we take, it's the combinations are usually not calcium and iron together. They are most of calcium and vitamin D usually are together, and iron can be separate. What I was saying is, do not take the tablets together in the sense timing wise. You have to give a gap, because what happens is they interact with each other and then it becomes sort of an issue. Another thing is multivitamins. A lot of multivitamins need not be taken. I would say that try to maximum take through fruits if you're able to. Now again, we have to understand that fruits, not everybody might be able to bite, and fruits, the best way of taking is taking it properly. I mean, cutting them and eating them. Juices are not that, I mean, health wise are not that great as compared to the fruit per se. So it will always be better if you're not. That is why I say you should always be open to supplements as you get older, is because it might just be that you're not able to do it purely because you don't have teeth, or there are other issues which might actually stop you. For example, a lot of people have dryness, oral dryness. They are not able to eat, the difficulty in chewing. So all those things. So that's why I said, when you talk about older adults, you just don't talk about medications and diseases. There are a lot of other factors which matter a lot.
Does having supplements like calcium with coffee after breakfast reduce its absorption?
I would say supplements, whatever you take, it would be best that you take it with water. Purely because not that caffeine is directly going to interact with that, but water has a better solubility. There are certain things which are fat soluble. There are certain things which are water soluble, even the vitamins. So one has to know, of course, you might not be able to go to those nitty-gritties, but try to, I would say, maximum with water. Usually milk is also fine, but coffee and tea might sort of interact purely because of the caffeine. Not always, it's not an issue, but one has to be, for example, I mean, as far as when you said coffee, so I just remembered, you should not take a lot of coffee in the evening because it sort of triggers urination, especially before sleeping. So one has to be very, very careful. You might end up blaming a medicine, whereas it might be the coffee. So because caffeine is sort of an inducer as far as urine is concerned.
Absolutely. Thank you. Connected to that, so you did mention like you can't break a capsule into half. So there are times when people are unable to really, swallow the medicine. So you either crush it and give it to them, especially for older adults who may be facing, getting really old, super seniors. So in that case, is it equally effective if you follow that?
Yeah, it is sort of effective. It's not, it won't be effective purely because in that particular time you're directly, I mean, a lot of times, for example, a lot of older adults, unfortunately, if they're bedridden and they have a Riles tube, it doesn't really matter because it directly goes into the tummy. And the coating is usually given because as you go from the oral cavity to basically the esophagus, the tummy, and then it gets digested. So in that, obviously, in that particular form, it's more of protective layering. So I think, yeah, it should be fine. It's not an issue. Of course, it depends upon, I mean, you should not, that's why a lot of times I say it doesn't mean that you open up all the capsules and start eating that way. But in general, I have seen that older adults are quite comfortable with, if they're comfortable with chewing, they like the ones which are more soluble. Now, more and more things are coming where you can just keep tablets under your tongue and they just dissolve themselves. So that is also coming. So as you say, technology is also advancing in the formulary as well, the type of medicine, how can you do? So the more the emergency, for example, people with cardiac patients are always told to keep certain medicines in their pocket. So if they have a chest pain, you cannot wait for, to take that, then the water, because that will take much more time as compared to you just putting it under your tongue and then it gets easily absorbed. So as we are going ahead, there is obviously advance. So yeah, I mean, that should not be a problem.
Right. Thank you. So another question is, if one take, suppose somebody has to take 4 to 5 medications at one time, could they all be taken together or should a gap be given for a few minutes?
I would say it's better to take a gap few minutes. The reason I am saying is that we don't want to end up in a situation where that one of the medicines actually goes into your sort of chest and then you end up coughing and then it becomes up an issue, because 4 to 5 medications of different sizes and shapes can be very difficult to take at one time. So just maybe give yourself a few minutes and then try to take them rather than taking 5 to 6 medications together. I think that would be better as far as the feasibility is also concerned.
So, this is about an older adult who has taken diabetes medicine for 4 years and has started losing her taste completely and has made her very intolerant to eating. And because of which she cannot take medication without eating. And because she cannot take medication without eating. And this is the issue. And the older adult already has medicines, takes medicines for high BP, diabetes, thyroid, and blood thinners and painkillers. But she's finding it difficult to eat. So in this case, what would the solution be?
Now, again, if the medicines obviously can be crushed, then it will be easier here. It depends upon what type of medication that she's on. So I think that would be the way out. Another thing is, if it's only a loss of taste, we need to see the reason of it. We need to understand, is it because of the teeth? Is it because of the loss of taste? It is because of the tongue? Is it because there is a problem with chewing? Because see, the thing is, for example, when we say that an older adult has decreased sleep, now it's sleep is very important. So it's not just that they don't get sleep, whether it's a difficulty in starting to sleep, whether after sleeping they are getting up, are they getting up for urination? That's right. So the cause has to be known particularly, and then only we can obviously sort of treat this particular individual, because a lot of times we just tend to put it on one cause. No, they can't chew. So then it becomes difficult. But in this case, it could be multiple. Or a lot of times people have ulcers in the mouth, and it becomes very, very difficult for them to eat. So it becomes very irritating also, and that's why they just can't sort of eat. So I think as a caregiver, if you are taking care, or if there is a nurse or somebody, try to keep checking things as far as oral things are also concerned. It could be a tooth which is painful and they are not able to express. So I think these small things have major sort of repercussions for older adults. So they need to be checked frequently.
Thank you, doctor. There's a question that says, doctor, could you tell us what are the body conditions that come with aging so that we don't rush to a doctor for temporary discomforts?
Again, I would say that it's very relative. For example, if you have a headache and that headache can be tolerated by you for a week, then it's okay. Somebody might get a headache and they might not be able to tolerate it, and they might have to see the doctor the same day. But I would say things like, for example, you can have issues of constipation, you can have issues of gastritis. So that will be by regularizing your diet itself, it will help. Now, a lot of times we have diet, we are like, no, everything is right. But what is happening is you're having your breakfast at one time, you're having your dinner more gap, then your lunch is, there is a bigger gap. The type of food, for example, you're having all spicy and this food, maybe you like it, but it doesn't agree with you. Having it in between is okay, but if it doesn't agree with you and you continue to have it. So small things can be taken care, but things like, losing your memory, feeling low, mental health is very, very important. Try to seek a doctor for mental health rather than thinking what is going to happen. He or she is only going to talk to me. No, it makes a difference. A lot of times you might not be able to express things to your caregiver, but you're able to express to another person who might know the best way to ask you the questions. Then things like diseases that you have should never be try to manage it on your own. Another thing which I would like to highlight is never ever take any pill on your own. Somebody should know, whether it is your relative, whether it's your caregiver, whether it's your doctor. If you want to ask the doctor, try to do that. Maybe sometimes the turn back time is more, obviously, because if you WhatsApp these days or if you call, it's not necessary that the doctor is not telling you because he's busy doing something else. It's that another patient he might be seeing. So it might take a while for him to get back to you. Never change doses of your medications on your own. Never stop medications on your own. These are all things which are very, very important, because sometimes people just stop it and then suddenly there are side effects to the same. So that's why I said that review your medications regularly, but that doesn't mean review and stop. When you're increasing the dose, no, aaj thoda BP zyada hai, let me just increase it yourself. No, don't do that, because that can have other issues. So be very careful as far as medications are concerned.
Thank you. And that's relevant across ages. So thank you very much. So Maya has asked, thanks to COVID, my doctor has been trying to get me to do an online consultation, which she is not comfortable with. She's 75 and she would prefer to have a face-to-face consultation. This is also necessary for my being able to ask questions that may be bothering me. So Maya, I guess you want to ask if, is it better to have a face-to-face consultation? So that is the, the question that she
What I would say is, it's really, really nice that through technology, at least I am able to reach a patient which I couldn't have before. For example, a bedridden patient, I would have to do a home visit and then only I can see. Now, at least I know what I'm going to see before I go home. So online is good only. I understand you're not sort of comfortable with it. But if you're not comfortable with it, there is the best way. I mean, if you give me a choice that, yeah, you should see physically, yes, physically obviously comes first, purely because we are also able to see you in person and we are also able to obviously examine you. If you're not comfortable with online, then just take the precautions. In the era of COVID, you just have to make sure you wear your mask, have your hand rub in yourself, in your hand. Yes, in now day and age where the things have opened up, you will be tensed. Yeah, other people are not wearing masks, but see, you have to be safe. So you take the precautions and you go attend your doctor's appointment and come back. I mean, that's what you can do. And I'm sure you might have done whatever you can. You might have taken your vaccinations as well. And in this case, if you have had COVID before, then of course there's another story. So I would say be prepared to go, but don't get tensed about it, because longer the online thing is being created, it is comfortable for you. So if you're able to do it as a thing of comfort, well and good. But if you're not, then please go to your doctor and take the precautions while you do it, so that at least you have your mental peace that, oh my God, I'm not going for a war. I'm just going to sort of go to see my doctor.
Thank you for that. So there's a question which is, how often do we need to go for an eye checkup? Though, would you like to answer that?
Eye checkup, I think, again, it depends on your disease, but once yearly minimum should be done, purely because a lot of, I mean, it's very, very common. You are saying, nay, it's okay. Number seems increased, but you're managing. So you realize that you have been managing too long, to an extent where you start getting headache. And this happens in all ages. Let me be very frank. So it's better that you have an yearly checkup. Of course, if you have diabetes and if you have blood pressure and there are certain changes which occur in the eyes, so then you might be called for a frequent checkup, maybe once in 6 months, because the progression can happen very, very quickly.
Thank you. So you did talk about, food and drug interaction, but not all doctors really explain this to the patient going to them or the caregiver. So how does a caregiver or the older adult become aware of it?
Yeah, so of course, one way to do it will be that you actually have a look at the medicine per se. But let me be frank, you might need a big magnifying glass when you have to read the medicine description, because it's all in the smallest font which is available, and it has too many things which will scare you. So I would say questions that you ask your doctor will obviously help you. Caregivers can of course get knowledge. See, my problem with Google is, if you see it just in Google, you should know where to look at. If you look at a official site, for example, the Ministry of Health and Family Welfare, that's an official site. Then it's a WHO site, that's an official site. So it has to be something which is certified, and then you are able to know. But if you still have doubts, please ask your doctor, because don't draw to conclusions only from online. That is what I meant by that. Another important thing which I just remembered when you asked me is, just because the drug works for your wife or your husband doesn't mean it works for you. So my doctor told me that I have hypertension, so let me take the medicine that my wife is taking. No, you are a different individual, your wife is a different individual, and vice versa. So you should go to your doctor. Maybe you need a lower dose as compared to, so there is no what do you call also all for everybody kind of a situation, in which just because somebody is taking one medication, you should also be taking the same. So be very, very careful about that. I know a lot of older adults, especially couples, who have started medications because my wife is taking, so I also started because my BP was also raised. So that is something you should not do.
Thank you for the doctor. Nalini, I see that you have, we did take your question. You have said the problem is taste affecting gulping. We hope your question was answered. You can put a message in the chat box. So I'll go to the next question now. So what happens when a long time medication is changed, say by a new doctor after a surgery or some medical procedure? And in that case, the coordination is often difficult for the caregiver. So how do you align at that time? Connected to what we first asked you about aligning with the one main doctor.
Yes. So I would say whenever a medicine is also changed, there is a reason for it. So I mean, the best way to align this, of course, is trust your doctor who has actually changed it. Sometimes you have to change. For example, you change regions. You might be living somewhere, but for whatever reason, you might have to change. Maybe it's whether it's financial dependence, whether it's just the fact that you're dependent on your children, or you have changed with your wife or husband to another elder community, which happens very commonly. People might be living somewhere, but they want to change over to Nana Nani homes because they feel they want to enjoy life with other older adults. So in that case, you have to trust your new doctor. But at the same time, generally, I actually also ask which doctor you saw and try to at least give a single call or a message. If I get a reply, fine. If I don't, then of course I take my own decisions, which can be sort of taken. That's not much of an issue. But I would say trust your new doctor. Because whatever decisions are taken will be taken into consideration your health only. I mean, it's not necessary that just because you have come to another doctor, the medicine will be changing, which is a misnomer. So for example, if you come to me always, I'm not going to give you a medicine. If you need it, then only I'll be given, because a lot of times This is just a general conception that when you go to a doctor, you need to receive a medication. No, if you're completely fit, you don't need a medication.
Thank you. We'll be wrapping up in another 10-12 minutes. So if you have any questions, please start putting them in the chat box so that we can take it up in another 10-15 minutes. So moving on to the next one. So, connected to that, if a new medication is giving an unexpected side effect, so, how do you deal with it? Do you wait it out for a few days, or do you immediately call your doctor? And like you said, swelling, it may, if it's an unexpected side effect. So how do you sort of, deal with it immediately?
See, if it is going to cause a big significant change to your health, then you need to, for example, sometimes feet swelling just goes off. But if the sweet swelling, a lot of times swelling can be so much that a person is not even able to wear their sandals, not able to wear their chappal. So then it becomes an issue. So then obviously you need to visit the doctor, revisit the doctor. And then of course, there is obviously a sort of way where you can get in touch with the doctor, whether it's a secretary, whether it's the hospital. And then now this is what has changed in the post-COVID era. You can still get in touch with the doctor online the same day, if you get obviously an appointment. So I think that is the difference in which you can still get things immediately done if you need to. There are certain glaring things. For example, you have been taking a painkiller without everybody's knowledge, and you suddenly start what do you call vomiting blood. That is happening. Then you have an issue, because obviously then you need to sort of go to the doctor immediately. And at that time, one has to understand that your doctor might not be the one who might be accessible purely because of distances. You might have to go to the nearest hospital. So that is also something you have to be practical a lot of times, especially the caregivers, because they might be the ones who have to take the decisions in trying to take them if there is an emergency. A lot of times when you contact the doctor themselves might say, no, this is an expected side effect. Don't worry, this will be gone. Or for example, when we give something for sleep, we always make sure that telling that, no, this might cause you drowsiness. If you get up the next day and you're very drowsy, stop it. We will get you on another drug. So, I mean, those are the ways you can sort of tackle it. But again, certain medicines might have certain things, or certain medicines cannot have certain. So one has to be very, very particular, especially the nausea vomiting part, because almost every medicine is expected to do that, but that not necessary you will get it with every medicine.
Thank you, doctor. Connected to that, Shivajini has asked, can swelling of the feet come after taking a medication for years for high BP?
Now, the thing is, it's very difficult for me to answer without knowing a history, purely because there are multiple causes of swelling of feet. It could be because of the kidney, it could be because of the liver, it could be because of the heart, it could be because of thyroid, it could be because of medications. A lot of medications can cause. Now, so suddenly if it is resurfacing, then of course you need to look into it. Now, if it's a major issue, you're having breathlessness or having another symptoms also, you definitely have to look into it. Now we correlate drug side effects and drug dose changes if we have done something recently and then it has started coming, and we withdraw the drug and we realize, no, now it's basically because of the drug.
Thank you, doctor. Another question is it necessary to finish a prescribed course of medication even if I start feeling better?
Absolutely, because the thing is, the prescription is given not because of the fact that we tend to know that you are going to feel better during the course. That's why we prescribe the drugs. But every drug has its course. For example, if you give an antibiotic, you say that you're feeling okay day 3, but the course is for 5 days, then you are just taking an incomplete course. And which means, again, there is a chance you might get infection. And at the same time, there are certain people who continue to take. That also should not be done. You have to take it. If it's for 5 days, you have to take it for 5 days. Then in diseases which can be only modified and not treated completely, for example, blood pressure, you might have to regularize the dosages. So do not stop those medications just because today you saw the BP seems okay, because then there will be so much of fluctuation. Then same thing you can do with sugars. When you take an anti-diabetic drug, obviously your sugar will get controlled, but that doesn't mean you stop. So I think no trigger happy sort of reactions with medicines. Try to finish the course. Again, if you're developing a side effect to any medicine, then of course get in touch with the doctor so that it can be changed rather than waiting for it to become worse.
Thank you. So another question is, what happens if I for instance, hypertension medications can sometimes be in the morning. So what happens if I miss a dose? Is it okay to take it any other time?
Yeah, actually, I had highlighted it that, yeah, you can. But again, as I told earlier, it doesn't mean you miss 3-4 doses, 3 days, 4 days in a row, and then say that, oh my God, I forgot. And now I can take. Then you can't take all the doses together. That is one. Secondly, for example, if you have a 10 milligram tablet in the morning and you sort of forget it, and then you also have another dose of 10 milligram in the night. So usually certain drugs, higher doses can be taken. Certain drugs, higher doses cannot be taken. So we then say you take your normal dose and then try to regularize from next day. One single dose, maybe 2, maybe 3 in a single day might not make much of a difference, but continuously taking doses might make a difference. Life-saving drugs are very important. For example, blood thinners. Blood thinners are very, very important, which you take for the heart. If you don't take them for some time, a week or 10 days or 15 days or 1 month, then there is a stronger chance that you might end up blockaging of the arteries of the heart. And of course, you might having a heart attack.
Thank you. Mr. Jambunathan has a question. Today's session, okay, I'll just paraphrase it. There are not many family doctors to guide the older adult. In such a situation, can a geriatrician be treated as a GP? Doctor has answered that. He is also asked, incidentally, what are the BP numbers for an older adult?
Again, they are different for different people with condition and without condition. So for example, if somebody has a kidney disease, it's slightly on the higher side. If you are absolutely normal, then one can say that 120/80, 139, 130/90 is also okay. But the fact of the matter is, we are also worried about low BP. A lot of older adults might have low BP and they might actually end up falling because of that. Anything of more or less is not good. Same is with sugars. If you have diabetes and your sugars continue to go below 100, then that is not good. Too much of control is not usually good. You should have it in adequate control.
Thank you. Would you like to quickly answer the first part of his question, which is can a geriatrician be treated as a family doctor, a GP?
I would say both are different, but yeah, a geriatrician can be a family physician in a big way, because, for example, we always say that for a kid, you will say, oh, that is my pediatrician, that is my child's doctor. So why not for you? For you, obviously, you can say that it is your geriatrician. So I think that should not be much of an issue. Absolutely treated the same. But yeah, of course, a geriatrician and a GP are different, because a GP will always deal with issues of all ages, whereas a geriatrician is specifically dealing with issues usually above 50, 55. The age is above 60, but we know that the changes which are taking, they obviously take above 50.
So what would be the right age a person should start consulting a geriatrician?
I would say usually the best time to not, I would say best time to even consult a geriatrician in general would be 55 plus 60. 60 is the ideal age for the first time if you want to look at it. But the best time, and this is for caregivers, the best time to take care of your health is in your 30s, because you're not suddenly going to get sick. Sudden things happen, but they build up over the years. So try to take care of yourself through the 30s, 40s, and so that you can make sure that you're having more fitter 50s, 60s, 70s, 80s.
Absolutely, yes. We all need to remember that. There's a question, what happens if I accidentally take expired medicines?
Usually, it depends on what medication you're taking again. Now, what the expiry is. Now, for example, if you take a single dose of a medicine which doesn't matter, then it's not going to be. For example, if a paracetamol you just take maybe an expired for 1 day, you might not have a side effect. But for example, a blood thinner you might take, it could or could not have a side effect. When it is, for example, if it's a 2022 you're looking at, and this drug has expired in 2020, then that obviously can be an issue. That's why it is obviously mandatory. If you see all the pharmacies that they give, they are supposed to, in that bill. So always take your bills. To be very frank, the manufacturer date and the expiry date always has to be mentioned in the bills as well, because one has to understand that when you're, because that's a better way to actually, or in the bill it is always there, whether it's online or whether it's the hard bill, it is always mentioned, purely because you need to see. Another problem you might face is sometimes having vision issues. The sort of manufacture and expiry date gets obviously muffled in the color of the strip. So that is also something. That's why it's very, very important that you have a separate sort of receipt in which the expiry is. And usually the receipt is always given with expiry dates.
Right, absolutely. So one of the last questions, as a geriatric doctor, what parameters do you suggest for the elderly to monitor and check and test for various important organs, considering normal health issues with elders?
Yeah, I would say a routine health checkup at your near hospital should suffice. And of course, if you are able to sort of consult a geriatrician before that, then you will be able to see which specific tests need to be done. But a routine health checkup around your hospital should be.
So any particular parameters to keep in mind or would that be?
No, I mean, just there's almost every every hospital now has a geriatric health package. So that should be fine.
Okay, taking that package would be fine. Okay, let me just see if there are any more questions. And in case, while I'm looking, in case there's any point that you would like to share with the audience, doctor, please go ahead.
I would say you yourself have to be dedicated to your drugs. So I think a sense of responsibility has to be there from you as patients as well. But I can also understand there are a lot of challenges from an older adult side. So the caregiver becomes most important. Again, the caregiver might be a spouse who themselves might be old. So that also might be an issue. In that case, we need to facilitate it as children or as kin, whether it's a caregiver who's there, whether it's 24 hours, whether it's only for giving, whether it's a cook or a maid or whoever is, but we have to make sure that those medications have been taken properly, because at that time challenges can be a lot. Then pill reminders, which can be done throughout the day. Of course, you might be in another part of the planet and there might be time differences. Then try to get people who can. Now, a lot of times, I would say there should be older adults, 60s, 70s, or maybe even older people, 80s who are fit, who should take care of unfit older adults. So that responsibility is very much within the older adults only. But of course, this means fit older adults and not older adults who are not sort of independent. So I think the takeaway message is know your medications rather than putting it entirely on the doctor or your caregiver. Try to know how many times you have to take. You might be forgetting it again and again. Try to write it down. Try to help yourself to make sure that you're taking drugs in a better way. Again, don't be trigger happy. Drugs are not always the solution. So over-the-counter drugs, please try to avoid to a maximum extent. Try to get in touch with your doctor and only take certain drugs. You might not have side effects. Certain drugs, especially like sleeping pills, you should not be taken over the counter at all, because they can have quite a bit of side effects, which can be life-threatening as well.
Thank you very much. Those were very important pointers. And thank you everyone for joining in. And Dr. Prem, thank you once again for a really wonderful session.
Yeah, thank you. And of course, just to finish, if at all anybody wants to get in touch with me, you can get in touch with Reshmi, Silver Talkies. They can connect you with me.